listening to Caregiver Crossing, a podcast brought to you by Joy's House, presented in partnership with Cardon and Associates. And we're really happy you're here. Caregiver Crossing is a podcast created just for you, the caregiver. I'm Tina McIntosh.
I'm her friend, Terry Lynn Stacy.
She's not wrong about that. Terry, I'm so glad to be back at things here. And
Me
well,
too.
we're going to talk
Happy
about
New Year.
Yeah, it's hard to believe. And, with the turn of the new year, we start thinking about family dynamics and loved ones and all of the things. And I know we get a lot of phone calls at Joy's House about people who are terminally ill. And so when that happens, we've talked before in Caregiver Crossing about hospice care. We've talked about palliative care and the differences in these things. And so Helen Bauer is with us. She is a registered nurse and certified hospice and palliative care nurse. And she joins us to talk about options and things that we should keep in mind when we get to that point with a loved one or ourselves, and we're talking about hospice care. So first of all, Helen, welcome to Caregiver Crossing.
Thank you. I'm so excited to talk with you guys today.
And I understand you have your own podcast too that we'll talk about here in just a minute. But Terry, I know you've got questions about hospice care in general. So why don't you take us in?
Well, I will tell you that this is something that has been a part of our conversation since holidays. And so it's, I think, getting to that point when you realize you do need hospice care and actually saying that out loud because you are in denial, I think, for right. Helen, is that a normal feeling to be in denial that your loved one needs to need some hospice care?
Oh, absolutely. Absolutely. Especially around the holidays, since you're mentioning that, people really don't want to talk about what it comes down to is death and dying and losing someone around the hugolidays. So yeah, there's a lot of resistance to it, a lot of denial, even though for a lot of people, hospice is a hugely advantageous service.
And explain
before
why
we talk
that
the
is.
details. Well, Terry, before we do that, I'm going to ask you a personal question because you said it's something you've been thinking about during the families. And so I don't want you to say anything you're uncomfortable saying. I'm assuming you're talking about with someone that you love.
Yes. For me, yes,
Yeah.
It is. It is.
Yeah.
We've, my father has taken a turn and he had a stroke earlier in the summer. He had another stroke just after Christmas. And they've also found that he has cancer on his colon. And so there's a lot going on right now. And the doctors came to talk to us about palliative care and about hospice and to be thinking about that in the plan. And I'm with my family right now, a sister and a mom that are both saying, we're not there yet. So if you would, Helen, explain to us what those advantages of hospice care.
Okay. Well, Terry, first of all, I would say what you guys are talking about and all those feelings that you're having, that's completely normal. Even in a group of small caregivers like you and your sister and your mom, there are bound to be different styles of caregiving and different levels of acceptance emotionally and mentally. So it's completely normal. None of it's bad or unhealthy. It's typical of what we see when we have these conversations. So to talk about when you're having to consider hospice, to get those conversations started, a lot of times those recommendations do come from your physician or your healthcare team. And families and patients, people with serious illness may figure it out before the healthcare team gets there or before the healthcare team mentions it, because there's some resistance and some reluctance to talk about hospice, even among healthcare people. So when you have a situation like your dad, where his status has declined, his health status is not as good, it's important to have those conversations slowly and in small increments, because it's much easier to digest and to process. There's a lot of grief associated with taking on hospice care and accepting it. And I think that's especially one of the reasons people are resistant to getting it started. But what we call low and slow is how we do things in hospice with medicines and things like that, education. And I think that's the best way to start those conversations. Start them off slow and in really small increments and have way more than just one. It's never a one and done.
Helen, I know that you have had to do this a bazillion times, but what is hospice for people who are like, I just don't get it? In very simple terms, what is hospice and what is palliative care?
So hospice is a philosophy of care. It's not curative. It's considered a palliative form, although palliative care is a different specialty. It's a type of care that's provided to people who have life-limiting illnesses. The patient has a diagnosis that's not treatable, or they've chosen not to pursue any treatment or further treatment, which in hospice we call that aggressive care or curative care. And it gets a little bit tricky because palliative care is actually its own specialty, but in hospice, we always include palliative care. Not as a specialty, but that type of care, symptom management and comfort management, that's always part of hospice. So the way I was trained was all of hospice contains palliative care, but palliative care as a specialty does not contain hospice.
But it's easy when you say that, it's easy to understand why people get confused.
Oh,
I mean,
absolutely.
I feel like Terry and I have head against wall, like, I don't get it. So that's a very easy way to help us. And is hospice truly 6 months or less to live, or is that changed over time?
So that was the original benefit inside Medicare that CMS designed. And that still stands, but it's on the paperwork side of things. To say that a patient is terminally ill is to assign a 6-month life expectancy, a 6-month prognosis. But if a patient at the end of the 6 months still qualifies for hospice, then the hospice agency just recertifies the patient and the care continues.
I'm curious. I think that my family is under the, I think they think that hospice care means taking him somewhere. And so I'm asking, I guess my question is, hospice can also be in your own home?
Right. Hospice is a philosophy of care versus a place. There are hospice homes or hospice houses where hospice care is practiced for terminally ill patients, but hospice is not a place where people go, like a hospital or a nursing home. Hospice, almost all of it is provided in a patient's home, wherever they call a home, whether it's a private residence or a nursing home even, an assisted living, a personal care home, a privately owned personal care home. We even provide hospice care for people who are homeless living on the streets.
Yeah, I think that's incredible for people who don't have an address where they can go and get the care that they need at the end of life. So we mentioned at the top that Helen Bauer is with us and that she has her own podcast, The Heart of Hospice. So the Heart of Hospice podcast. What kinds of things do you talk about most on that show?
Oh, wow. It's been going for 6 years. So we've pretty much talked about anything related to hospice and end-of-life care. In the last year, with everything going on in the 3 years of the pandemic, we talked a lot about grief last year and bereavement. We also talk a lot about self-care because our audience are people that are caregivers or patients, but they're also hospice professionals as well. And so what we try to do is mix it so we get content that providers need and content that consumers need to empower consumers, help them be better advocates for their own care, and then to help the hospice professionals understand the perspective of patients and caregivers. That way we better meet their needs.
Okay, so I have a question about that.
Sure.
Is there something that comes to mind when you think about the grief period? Not even necessarily at the time of someone's death, but the grief period that even leads up to that, right? Is there something magical that you have discovered or learned along the way?
So what you're talking about is anticipatory grief.
Yes.
What I have learned is that anticipatory grief a lot of times doesn't have anything to do with the death. Because when it starts, sometimes it starts at diagnosis, like Terry, your dad and your mom being told that your dad has cancer. That's a grieving immediately. It's a loss of identity. It's a loss of security. For a lot of people, it's a loss of function. It's a loss of mental capacity, a loss of a wage earner. And there's so many layers to anticipatory grief. And I think we learned that during the pandemic, that grief is this weird thing. We lost ritual, we lost socialization, gathering, relationships that became distant. And so for me to identify that anticipatory grief is a much bigger ball of wax than I had realized before.
I feel like we could have an entire podcast series on coming, I'm not going to say out, is not the right word, but being on this side of the pandemic and that anticipatory grief. But I know that's a whole, different thing. Terry, any other questions from your perspective? And I want, while you're thinking about that, I want to say thank you. Anybody who has met Terry Stacy, whether it's in Indianapolis, Indiana, or more, falls in love with her instantly. She is exactly who you think she is. And so the fact, Terry, that you come on this show as a co-host and that you are so vulnerable to share where your family is with things and where you are in life, I know people are grateful. I'm grateful as your co-host. So thank you.
Thank you. Thank you for saying that. I feel like this show, Caregiver Crossing, which has been on for a long time, has given me a lot of strength and understanding. And we get to have those topics that are hard to talk about sometimes. And it's helping me at this moment be a little more prepared when I hear words like palliative and I also hear the words hospice. These are conversations that we've had before. Nonetheless, it still is a hard thing to hear and to know. But I've been grateful. My father, I've had him for 87 years, so I'm so very, very grateful for that, for sure. And it's my mom that I worry about now, the main caregiver, and what she's going through. And she is going through denial right now. I mean, she's taking it. She's a strong woman, always has been. And she's taking it she just keeps telling us, take it moment by moment and stop thinking about the future. Doctors are telling her, think about the future. But my mom is he is alive and well, and he's in a good place right this moment. And that's what I'm going to look at right this minute. So I know we're going to have that conversation, and I don't know how much time we have, but I was really hoping that, Helen, you could help us to know what I should be looking for, what we should be looking for when it comes to hospice care.
So when you think about how to get started, there are several things that I think they're important to look for, and definitely things to ask when you're having to think about hospice. I think that everybody, if there's time and there's energy, bandwidth to do it, that people should shop around for a hospice. A lot of people don't realize that the patient or the decision maker for the patient has the right to choose the hospice agency. You do not have to go with the hospice agency that your doctor may mention to you. You have the right to choose. And I think it's important, if there's energy and time to do it, to shop around. I usually recommend talking to 3 different agencies, and you'll get a representative, somebody from that agency, who comes and talks to your family and talks to you about the kind of culture and the care that they provide. I think it's super important to ask if the medical director of the hospice agency is a board certified hospice and palliative physician. I think that's very important. If it's important to the patient and the family, I think it's also good to ask whether the agency is for-profit or nonprofit. There's a lot of conversation going on out in healthcare these days because there are a lot of very large for-profit hospice companies, and all of them are providing about the same type of care. However, there are a lot of people that look at for-profit differently from nonprofit, and I won't say that one is worse or better than the other. I've seen both types of businesses provide wonderful care, but if that's important to you, I think that's a good question to ask.
Okay.
I think it's good to ask if the nurses are hospice and palliative care certified as well, because there's specialized training that comes with that certification, and that can be really, really useful.
Helen, as this year goes on, Joy's house, who is where Candace and I work, Candace is our producer, back from her second life at Joy's house and with Caregiver Crossing. We are starting an end-of-life doula program, and we would love to talk with you at some point just to see, how it might help the folks that you're working with in life and those that we are as well. So if we could have that conversation at some point, we will be launching here in 2023.
Awesome.
Yeah. I saw you gave, nobody could see that, but Helen gave the fist pump, yeah, buddy.
Yeah. End-of-life doulas are able to round out the care that we can't provide. They have some unique skills. They are the most open-hearted, creative, spirited, full of grace people that I have ever met when it comes to companioning with end of life. It's amazing.
Makes me want to cry, Helen. You just said words that I think Candace and our coworkers and I have been struggling to put together. How does it work with hospice and palliative care? But we will have that conversation. We'll have you back to talk about that. We would love to do that if you'd have us. In the meantime, the Heart of Hospice podcast, I was trying to look it up while we were talking, then I multitasking wasn't working for me. So I cannot wait to follow you and to learn from you. And I'm just so grateful that you do the work that you do. It's really, really important. So Helen Bauer, the Heart of Hospice podcast. Thank you for joining us here today on Caregiver Crossing.
Oh, thank you so much.
Thank you. Thank you for your help personally, I should say, because you were a big help to me just personally. Thank you very, very much, Helen. I'll be in touch with you for sure. As we close the show, we just would like to remind our listeners that they can contact Tina McIntosh for more information and resources to help you through your journey of caregiving. Tina at joycehouse.org. And we also have some fantastic people, Caregiver Crossing, supported by Cardon and Associates, with 20 communities owned, operated, or managed in the Midwest, and more than 40 years of senior living experience. Cardon and Associates provides residents with the best senior living options and personalized service. Until next time, take good care of each other, and thanks for listening. We'll join you next time on Caregiver Crossing.